Welcome, everyone. Thank you for attending this webinar entitled ThermiVa Is It Right for Me? I'm your presenter. I'm Dr. Natalie Drake. Well, the first thing I'm going to do is I'm going to take a poll and make sure everybody can hear me okay. Let's see. And I just like polls, so here we go. Let's see here. All right. Is everyone able to hear me clearly? All right. Okay, excellent. Okay, looks like everybody can hear me clearly. That's good. If you are logging in from a computer, it's best to use a headset. And if you're calling in, make sure you enter the audio pin. And I just want to remind you, if you have any questions, if you want to ask questions, please ask the question to the presenter only and not to the whole entire group. So, all right. Okay, so today we're here to talk about ThermiVa. All right, and I'm Dr. Natalie Drake. I'm a board-certified OBGYN with additional training in urogynecology and pelvic reconstructive surgery. My background, I trained in Dallas, and afterwards I did fellowship time at Duke University in urogynecology and pelvic reconstructive surgery. After that, I went back to Dallas to join my husband, who was in fellowship at Parkland Hospital doing GYN oncology fellowship. After that, we went to Cleveland, Ohio, and went on staff at the Cleveland Clinic in Cleveland, Ohio. Um, When I was in private practice in GYN, I noticed that there's a huge black hole in women's health care. And many women would come to me after childbirth and say to me that sex didn't feel the same after they went through their pregnancy and childbirth, or sex didn't feel the same as they were going through menopause. And many women also came to me and said that they have mild to moderate stress incontinence, but they didn't want to have surgery. I treated a number of women with vaginal atrophy and dryness, and they would use the Premarin creams or the estrogen creams, and it only gave them mild relief, and the creams were messy. They didn't like it, and they were non-compliant with the treatment because it didn't provide them that much help, and it was not fun to treat that way. So I felt like there was a big black hole in women's health care that was not being fulfilled. And as a physician, that was difficult. Physicians like to help their patients, and there was a huge area that I was unable to help patients with. So in 2013, my husband and I moved to the Houston area, and I stayed home with my children. And then in 2015, ThermiVa as a procedure came out, and I heard about this procedure and became so excited about it that I came out of retirement specifically to do ThermiVa because I felt like it filled that huge black hole in women's medicine that had been previously void. And I felt like I needed to come out of retirement and treat these women that had no options before that. It's a very fulfilling thing to do as a physician. All right, so what we're going to do today, we're first going to do a general overview of what ThermiVa is, and then we're going to talk about the science behind ThermiVa. We're going to watch a video of the treatment. We're going to talk about what to expect if you're getting a ThermiVa treatment. We're going to see what patients are saying about ThermiVa. We're going to go through a special offer that is only for webinar attendees. We're going to look at some before and after pictures, and then we're going to go through a question and answer session. Okay. All right, so ThermiVa, again, like I discussed before, was developed to meet the needs of women. It's painless, safe, non-surgical, and there's no downtime. You can have intercourse on the day of the procedure, and you can go back to work after having the procedure. Many women notice improvements after their very first treatment. Oops. There are 3 in-office treatments 1 month apart. And we think that as a maintenance protocol, women will most likely need 1 to 2 treatments per year to maintain the effect. Anytime that you are doing anti-aging procedures, you're still going to age after you have the procedure, and you'll still need a maintenance protocol. So we think 1 to 2 treatments per year. Okay, so how does ThermiVa work? ThermiVa is a radiofrequency procedure to the vagina and the perineum. Radiofrequency is basically a fancy way of heat transfer, of saying heat transfer. So what we do is we heat up the vagina and the perineum. This causes three different effects. There's immediate contraction of the collagen. Collagen is a protein that's involved in the structural support of your mucosa and your skin. And as we age, the coiling of the collagen relaxes. So there's an immediate contraction of the collagen back to the coiled back to a coiling. And then there's immediate collagen remodeling and an increase in elasticity of the tissue. Then in a long-term situation, there is stimulation of production of new collagen. That starts about 2 to 3 weeks out of each treatment and takes about 3 months to complete. So for each treatment, you will have an immediate result and long-term results. So the final results of the series of 3 treatments will take somewhere around 5 to 6 months to complete. Okay, so this is a pilot study done when ThermiVa was being developed. There were 23 patients treated in the same protocol, one treatment or 3 treatments done 1 month apart. This study was done to look at laxity, which was the original reason that ThermiVa was developed. So it found a 50% reduction in the symptoms of laxity. All the questionnaires showed measurable changes. Every patient showed measurable changes. And the effects lasted about 9 to 12 months. The big surprise, though, was the secondary benefits noted to the patients. Patients with atrophic changes became more moist and comfortable. Those with mild to moderate stress urinary incontinence, SUI means stress urinary incontinence, and that's the kind of bladder leakage that comes with coughing, laughing, and sneezing. But those in the study with mild to moderate stress incontinence were drier. And patients with orgasmic dysfunction were able to improve their sexual issues. Every patient in the study said they would do it again and would recommend it. All patients rated themselves as happy or very happy with the procedure. There were no blisters or burns or major complications, and there still haven't been nationally. No blisters, burns, or major complications. All patients rated the procedure as very comfortable, and all patients said that there was no downtime. Okay, so this is actually information on a study that just came out in November. This study was directly related to women with stress urinary incontinence, and it's a placebo-controlled study. So ThermiVa was shown to produce a statistically significant difference and an improvement in stress urinary incontinence scores. 70% of the women in the study had a resolution of the cough stress test, which is an objective measure of stress incontinence. They showed improvements in histology, which are biopsy specimens of the vaginal mucosa. There were improvements in vaginal health scores and improvements in subjective dryness and painful sex. And these changes and these improvements were not present in the placebo patients.
My name is Cindy. I'm 44 years old. After having my first child, I realized that things were different. I had a difficult delivery, and I had 2 surgeries post my first child. So I thought that was the way it was going to be.
My name is Jeanette, and I have 3 children. All my 3 children were vaginal delivery. With the last one, that's the one that created me more problems because my bladder dropped after delivering him, and also I got saggy because that big delivery.
I found out about ThermiVa through a conversation with some friends. They were discussing everything that it included, all the benefits, and I became very interested. It perked my interest quickly, realizing then that there was another option outside of surgery was very exciting.
You know that you have the problem and you want to fix it, but you don't know how to fix it.
I mean, I really didn't expect that it was going to work that quickly and no downtime, and it did. I was like, this is incredible.
I honestly say that thanks to ThermiVa, I regain a confidence.
I'm Red Allenside. I'm a urogynecologist here in Laguna Beach, California. ThermiVa treatments are radiofrequency treatments using this tiny little thing, barely the size of my finger, skinnier than my finger, that's able to reach in the nooks and crannies of the labia and inside the vagina in a really comfortable manner, so that you can place radiofrequency heat into tissues that will immediately shrink tissues and over time encourage more shrinkage of tissue and production of new collagen.
In addition to the tightening effects, we're getting basically regeneration of the nervous tissue in and around the vagina, which is why it's helping with people that experience overactive bladder, urgency, frequency, all those things.
This device, ThermiVa, it produces a gentle heat to treat the external labial structures and produces heat also for treatment deep inside the vagina. It's a warm, comfortable heat that's temperature controlled. You can set this little device to a certain temperature, let's say 40 degrees, 42 degrees Celsius, that we know will shrink tissues and change the structure of the tissues, so you can get results for incontinence, for vaginal tightening, for improved moisture that'll last you 9 months to a year. It's a remarkable little device. I love ThermiVa. It's changed my practice. It's helped me help my patients. I mean, I couldn't offer these things to my patients in the past, and now I have something to offer them.
I think with ThermiVa, it's addressing some things that really you've never been able to really make a huge impact on. What I've seen in patients is that the patients have really sincerely had life-changing experiences.
I feel so empowered, so excited, so different and youthful, inside and out.
This is going to bring so many improvements in the life of so many women. I am totally positive about ThermiVa. They are going to be very happy about ThermiVa.
Go to webinars acting up. So each treatment takes approximately 30 minutes, and once you're in the stirrups and you signed all the paperwork. And again, there's 3 treatments 1 month apart. ThermiVa treatments are completely pain-free. They do not require any anesthesia, and women compare them to a hot stone massage. Downtime, there's no downtime. You can resume sexual activity the same day. Results: many women see improvement after their first or their second session, and we recommend 1 to 2 treatments a year to maintain results. Okay, so this is a segment on RealSelf, on ThermiVa's reviews on RealSelf. If those of you who don't know RealSelf, RealSelf.com is a website where women, or well, people can leave candid reviews on medical and cosmetic procedures. And this is what women are saying about ThermiVa on RealSelf. So excellent ratings, and I'll give you guys just a few seconds to take a look at this. But women are saying it's well worth it. Significant reduction in urinary frequency, significant improvement in sexual stimulation, tightening of the vaginal wall, feel like a new woman. So definitely relief with pain with intercourse. Women have gone from needing lubricants with with intercourse every single time to not needing lubricants at all anymore. So it's getting excellent results on RealSelf. Okay, and then testimonials. I think patient testimonials are extremely powerful. So this is one. This is actually a patient of mine, and I'll give you guys a few seconds to take a look at that and read what she has to say, because I think these really say a lot about what ThermiVa does for a woman's quality of life. So. ThermiVa really has changed women's lives. The number of women that have come into me and have been in tears telling me exactly how it has completely changed their life. There are so many women out there who are unable to exercise and unable to do the things that they want to do in life. And this has absolutely changed it. And it takes women a long time actually to finally realize that, oh, they no longer can't go to Pilates, or they no longer can't jog. They can do all the things that they want to do. It's been an amazing thing as a physician to see what a difference I've been able to make in people's lives by treating them with ThermiVa. So, okay, so another testimonial. I love this testimonial. This one cracks me up. She says her desire was completely gone, and it would take her a couple of Ritas to get her close to in the mood. So I think this is a really funny one. Okay. All right. Okay, so is ThermiVa right for you? I'm just gonna. I like polls. I'd like to hear information about my audience. Okay. Okay, and remember, no one else can see your answers. So I'm gonna. Okay. Do you suffer from any of the following? Okay. Okay. All right. Okay. Yeah, it looks like a little bit of everything. Looks like there are a lot of women out there with every issue that ThermiVa treats. So I'm gonna see hide these results. Okay. All right, so it says, do you feel dry during intercourse? It says 33% of perimenopausal women, 50% of menopausal women suffer from atrophic vaginitis. And I actually think those numbers are a little bit low. I think actually it's probably higher than that. Do you have trouble reaching orgasm? Orgasmic dysfunction impacts nearly 1 in 3 women. And I believe that's 1 in 3 women in general. And I think as women, if you study women who are menopausal, I think that number may be higher too. Do you occasionally leak when you sneeze, cough, laugh, or exercise? 57% of women aged 40 to 60 are impacted by stress incontinence. That's a lot of women. Have you felt loose down there since childbirth or menopause? If so, then ThermiVa may be a good option for you. So, all right, for those of for women attending the webinar, there's a special offer. If you receive your first treatment before or on or before March 10th, you'll be entered into a drawing for a free 1-year follow-up treatment. So, for more information, this is the phone number and the website. I'll give you just a second to take down that information if you need to. Okay, and then now we're going to take a look at some before and after photos. Okay. All right, so this is an immediate effect. This is just immediately post one treatment. These pictures were most likely taken about 30 or 40 minutes apart. So you can tell some changes right through here, in particular from here to here. You can tell the rhytids or the wrinkles have gone, and you can tell about definitely through the tightening through here. So this one I think is a little bit more profound. This is changes over 3 months. And obviously there's a lot of tightening through here. You can see the laxity right through there. And yeah, so just a huge difference. Okay. This is after 3 treatments. And you can tell the tightening in the opening and the laxity on the outside through the labia majora and the minora both. Pretty profound changes. You can tell the tightening through here, both through the opening and the laxity through here to the bottom. and this is an immediate effect. This is actually one of my patients, and so these two pictures were taken about 40 minutes apart. Also, this is just before the first treatment and after the first treatment. So that is the effect of the very first treatment. So, all right, we're going to go and see if anybody has any questions. Here we go. Oh, somebody is hearing music during the, Well, somebody's question was, am I the only one here who can hear that annoying music? I'm not sure. I don't know. I can't hear any music. And is anyone else hearing any music? Okay, other people are popping in and they don't hear music. I'm not sure where that's coming from. So, so is anybody else have any questions about ThermiVa or the procedure? Let's see. Let's see. Yeah, I don't think other people are hearing their. Let's see here. Okay. Okay, so here we go. We have a question. How soon after can you have sex? You can actually have sex immediately after the procedure. I joke with the patients that their only requirement is they have to leave the office. So once they're out of the office, they're fine. So yes, I've had patients that have gone immediately home and had intercourse directly after the procedure within 30 minutes. So yes, no downtime at all. That's an excellent question. Okay. Oh, excellent question. Can patients with cancer have the procedure? And patients who've had a history of cancer and do not currently have cancer can have the procedure. Yes. Now, if you have had a history of radiation therapy to the pelvis, you can have the procedure. If you've had a history of chemotherapy, yes, you can have the procedure. If you currently have active cervical dysplasia that you're being treated for, we would want to wait till that cervical dysplasia, till that issue has been resolved. But if you've had a history of dysplasia in the past and that's currently resolved, you can have the procedure. And we want you to be up to date on your PAPs. So, here we go. What is the main difference between ThermiVa and Mona Lisa? Mona Lisa is a laser and only treats internally. So that would be a laser procedure to the inside only. And ThermiVa is radio frequency, which is just a warming. So it is completely non-invasive other than the fact that you're being treated internally to the vagina. There's no breaking of the skin. So it's it's just the heating of the mucosa, and ThermiVa treats internally and externally. So ThermiVa requires no icing and and no downtime. Let's see. So, okay. So yeah, next question are about cost. A package of 3 ThermiVa treatments, I charge $3,500 for the package of 3. Okay. Okay, and the next question is, will this help with rectal prolapse too? It depends. I think that probably depends on how the degree of rectal prolapse. I think that what you're doing is you're building collagen and providing structural support in the layer between the vagina and the rectum. And since you're doing that, there's a possibility of helping with rectal prolapse. But if your rectal prolapse is too severe, then it won't help with severe rectal prolapse. But excellent question. Let's see here. Let's see. Here we go. Is there a yearly follow-up? And if so, what would be the cost? Yes, yeah, we suggest 1 to 2 treatments per year as a follow-up to maintain the collagen levels that you've built up. And I'm charging $1,200 for the follow-up treatments if for my patients that got their original 3 treatments with me. Okay. Are there any other questions? Well, thank you so much, everyone, for attending. I really appreciate your audience, and there will be a recording of the webinar, and you'll get a follow-up email with a survey. I appreciate it. If you have any questions at all, give us a call at 281-402-3268, or you can take a look at our webinar, our website at www.practicehappiness.com. Again, I'm I'm Dr. Natalie Drake, and I was pleased to be your presenter today. Thank you so much for showing up.